Thank you, and nice to see all of you. Some familiar faces, and some of you I haven't met. So great to meet you virtually. I thought before we started, if you wouldn't mind just posting in the chat your familiarity level with Well Badger, where 1 is you have no idea what Well Badger is and what I'm talking about, and 10 is like, yep, I watched your presentation 18 months ago and I know all about you. And that'll help me kind of gauge how much detail to get in here. All right, we have from 1 to 10 so far. Anyone else want to weigh in? 7, 7, 8. Okay, so all right, we're skewing a little bit higher, but we have some people who don't know much about us. So if it's all right, I'll do a quick refresher on Well Badger, give you an opportunity to ask any questions, and then I'll jump into the Children's Mental and Behavioral Health Resource Navigator, which is my primary purpose for being with you today, to share a little bit about that project, and hopefully we can do a demo as well. So while I pull my screen up, I also have my colleague Miranda here. If you want to introduce yourself quickly, talk a little bit about your work and your goals as an outreach specialist.
Yes, thanks, Chrissy. So my name is Miranda. I'm new in my outreach specialist role, but not to the Women's Health Foundation. I've been a health educator on and off for about 4 years. So my goal working together with Chrissy is to make sure that everybody knows about the Well Badger Resource Center, and then specifically the Children's Mental Health Navigator that Chrissy will go into. So moving forward, I hope to see a lot of your faces again as we look at different ways that we can collaborate and get the resource out to folks that need it.
Great, thanks, Miranda. All right, we did our warm-up questions, so we can skip that. I thought I'd just share a little bit about Well Badger basics. Well Badger has been managed by the Wisconsin Women's Health Foundation for over 3 years now. The foundation is based in Madison, but we have a statewide presence. You may have heard of the Maternal and Child Health Hotline, Wisconsin First Step, or the Informed Consent Helplines. Those are all DHS hotlines that have been in existence for a couple of years. Those all still exist, but they were moved under the Well Badger umbrella a few years ago, and now we're operating, the Wisconsin Women's Health Foundation is operating those lines. Well Badger is kind of unique in that we have pooled funding from various programs at the Department of Health Services. You can see them listed there below. Badger Care, WIC, the Maternal Child Health Program, Children and Youth with Special Healthcare Needs, and the Wisconsin Well Woman Program. This is our current team. We kind of fall into 2 different categories. One is our information referral team. So they're working one-on-one with individuals and families day in and day out. And then we do have a pretty strong data component with our online directory that I'll talk about in a minute. So then we have our data people. And some are special and can do both. I don't quite understand that, but it's great to have them on the team as well. Our staff are based around the state. The actual INR team is mostly in Madison. We do have myself and Miranda are in Milwaukee, and we have a team member in Rhinelander as well to help out in the northern part of the state. And I think the biggest thing to take away from our team is that we really value lived experience. All of us have lived experience navigating and utilizing all the services and programs that we promote. These just a little bit about our aim. So our goal is really to increase utilization of all of the health and social service programs that are out there. So we want to match people with services that are accessible, affordable, and appropriate for their needs. We're really focused on improving health literacy as well. We want people to understand health information, of course, but how to obtain services, how to advocate for themselves and their families within various systems of care. And then we're really focused on addressing the root causes of health issues and health disparities, making sure people's basic needs are met, and really working creatively with individuals and families to try to reduce barriers to care as well. So these are the 2 different ways that we tackle those issues. One is through our one-on-one information and referral or INR services, and the second is through our online searchable directory, and I'll talk a little bit about each of those now. So with our INR, we have this team of certified resource specialists. So they, again, are working with families Monday through Friday, 7 a.m. to 6 p.m. People can contact us by phone, text, email, live chat, or Facebook Messenger. Right now, most of our cases are handled by phone, but we are seeing a huge uptick in people who want to get connected with services via text and live chat. And it's a lot of our younger families as well. They're much more liable to text than to pick up the phone. Our services are available in English and Spanish, although we do interpretive services for other languages. And one thing to point out is that individuals and families can contact us directly, or health professionals or social service professionals can contact us on behalf of a patient or client. So if they have someone who's really struggling or they have a lot of different needs or complex needs, that we can help health professionals help that family. So what those services means, I think first and foremost, we'll listen to that unique situation. We don't have, you have to do this call in 2 minutes. If it's a complicated case, we'll take our time to really get to know the family and what's going on. We help them to identify and prioritize those needs. We'll do eligibility screening and provide information. These are the services that we think are the best match for you. What do you think? And if we can come to an agreement, then we'll do a warm transfer to those services as well. And then we'll do short-term and long-term follow-up. So every single person who contacts us will say, in 2 weeks, can we give you a call, send you a text and see how things are going? If you weren't able to get connected to that service, we will find a different place that we can send you to, or maybe they have a different need. And then we also do long-term follow-up as well through text and email, so we can follow a family for up to a year if they want to. And we've been really surprised since we launched the long-term follow-up that a lot of people are opting into it. So I think that means that people have pretty significant needs, or they have a need that cannot be solved in the initial contact. So we're excited that we're able to offer that. So switching gears a little bit to our online directory, and if you are following along at home, feel free to jump on if you want to take a look, but this is our online searchable directory. I think at last count we had about 5,000 services listed, and it's searchable in 2 ways. You can do just a keyword search, or you can drill down by topic. So that's this image on the bottom right here. So people might not know exactly what they're looking for. That's okay. Just click the topic and you can see all of the different categories that we have. And in a minute, we can jump over and look at that. We like to tell people it's not a Google search. So everything in the directory has to meet really strict criteria. It has to be verified by the agency that provides that resource. And then the other thing that we really love about this directory is that we have searchable articles. They're really like information sheets. So some topics are not super straightforward. So we're able to have an info sheet that's also searchable so they can read about it and then connect with the resource. So an example is breastfeeding services. We have an info sheet for that. Another one is developmental screening. Not super straightforward, so we want to make sure people kind of understand what we're talking about before they connect with the service. And our Spanish version is coming very soon. We should be able to click a button and the whole thing will flip to Spanish. We're just doing some final spot checking to make sure that it's fully readable and comprehensible. So a little bit about who we help. We're open to anyone in Wisconsin, but we do have very specific focused populations and topics based on our funding sources, and to fill those kind of gaps, the more complex, I think, health needs. So we focus on low-income individuals and families, pregnant and postpartum and parenting people, and then children, youth with special health care needs, with a special focus on those with mental health needs. So you can see some of our numbers here. We help a good amount of families, but it's I would say it's select, I guess, in terms of people who are contacting us, and they usually fall under these focused populations. But again, we'll help anyone, and we have a pretty good utilization of our online directory too. And a couple of quotes here that I always like to share. So these are just some examples of questions that we would get on a daily basis or hourly basis. So enrolling in programs like WIC, Badger Care, and Food Share, having health symptoms and not having insurance, how do I get it checked out? Help understanding programs for children, youth with special health care needs. We get a lot of just like, I'm pregnant, I don't know what to do. So helping people kind of connect with the services they need and identify what are the primary needs right now. Of course, over the last close to year and a half, we've had a lot of contacts about COVID, people losing their job, can't pay their bills, need help navigating the sea of resources that are out there. And then this last one that I want to spend a little bit time on are finding, accessing, and paying for mental health services for a child or adolescent. So I will jump to that next. Before I do, does anyone have a quick question or clarification that I can provide about Well Badger?
I do. This is Kimberly. When it goes through, when you were talking about eligibility, are you actually clearing people for the to be able to service them, or are you going to the funding stream to CLTS or Medicaid waiver? What are you?
Yeah, yep, that's a great question. So we're doing pretty much basic eligibility. So we'll do, for Badger Care, for example, we'll find out how many household members, what is family income, to just kind of the basics. For WIC, we do go a little bit more in depth because we don't want to send anyone there that's truly not eligible. We try to make those connections pretty quickly. But for most of the other programs, we do basic eligibility and then do the warm transfer. Yeah, great question. Thanks. All right, so I will move on and now talk about our Children's Mental and Behavioral Health Navigator. So why do we have this in the first place? I'm probably preaching to the choir here, but I will say from Well Badger, really from day one, we found that the most complex cases were cases for children, youth with mental health concerns. They were the most complicated cases. Insurance-wise, they were complicated. And we really found that a lot of the caregivers were extremely frustrated. They were feeling hopeless, they were feeling annoyed, they felt that they had been passed around a lot. So we pretty much knew from day one that we needed to do something a little bit different and more, put forth a little bit more effort and get a little creative in terms of how we were going to handle these cases. Of course, we continue to help families one-on-one. We'll continue to do that till the end of time, but we wanted to do something a little bit more proactive, I guess, and could really capture some of those complexities. The other thing is, and again, I don't have to share that with this group, but obviously we have a pretty big mental health, youth mental health treatment gap here in Wisconsin. And those differences, of course, there's differences based on geography, mental health condition, and sociostructural factors. And then for top barriers to seeking mental health for adults, we know the top 3 are cost, not knowing where to go, and stigma. Right, I actually don't have those data for children. If anyone does, send them my way. I would love to see that, but I imagine it's something similar. And I think from our Well Badger INR experiences, it's pretty much the same thing. It's insurance battles. It's not, systems not talking to each other. All of the similar things that adults would experience, but just more acutely felt. So what is the Navigator and how does it work? So this is a free online resource navigator. It is meant for parents, caregivers, and health professionals to use on behalf of a child up to age 21. How it works is they'll complete an anonymous questionnaire that asks questions about the child, and then they'll receive a customized resource guide that includes suggested next steps, local and state resources, and then information, again, to promote that health literacy around children's mental health care within 8 systems of care. And a big shout out to our friends at Office of Children's Mental Health. We worked together to come up with the 8 systems of care, and then they provided this beautiful graphic design. So you'll see that prominently displayed in the resource navigator. Throughout the online resource navigator, we do have prompts to contact a Well Badger specialist. So if there's lower computer literacy level, they get stuck, it's taking too long, it's totally fine. They can just contact someone through live chat or call or email and just connect with someone one-on-one to basically get all of the same information in resource guide. And this has really been a 2-year process, the development of this. We've had wonderful families with lived experience, a lot of children's mental health professionals, some health literacy folks all jumping in to help make this thing happen. So it was a work in progress for a while, so we're excited that it's finally live and being utilized. So really our goals with this are, number one, we want to connect family with the services and resources that they need and that they deserve, and that they may have not realized that they were even eligible for, or that were in their community. We want to increase confidence in navigating those services and advocating for their child and their family. Health literacy is a big component of this. I talked about those kind of info sheets. I believe we have 14 throughout this navigator that people can click into or not if they feel comfortable with the information. And again, we really are aiming to reduce stigma associated with seeking services for their child. So I think we're going to move on to the demo. So I'm going to stop sharing my screen and open up my browser now. If you want to, if you're a hands-on person and want to do this on your own computer, feel free, or on your phone, or you can follow along with me. And I would love it if I could have one volunteer that would answer the anonymous survey with just a fake child so we can see what happens. So do I have any volunteers that are willing to do that? All right, I see Scott is raising his hand. Thank you, Scott. So let me pull this up and then we will go through it. So I guess I should have shared the URL with you. If you didn't grab it, let me just pull this up and we can go through it together. All right, so if anyone is struggling to get in, just pop it into the chat. And Miranda, if you don't mind, I'm just putting in the URL so people can click to it if they're having trouble. But otherwise, we'll go through this together. So this is our main landing page. It lives within the Well Badger domain. Basically, we have our what it is, some disclaimer information, and then we are starting the Navigator right here. So if you're following along, go ahead and click that button. And of course, my computer is going to be slow. All right, Scott, so are we ready? What statement best describes you? Are you a parent or caregiver or a professional that works with children or youth?
Parent, caregiver.
Okay. And how old is the child?
4.
Okay. What county does the child live in?
Polk County.
Great. All right, and what school district does your child reside in?
Well, they don't go. St. Croix Falls.
Okay, thank you. And I do have a note here, just an FYI for you, that if the child attends a private school or they're homeschooled or they're too young, we still want them to enter the school district, and that will make more sense once we get into school-based services. Next, we're going to talk about primary care. So does the child have a primary care doctor? Yes, no, or unsure?
Unsure.
Okay. And which type of insurance does the child have? Private, Badger Care, state, no insurance, or don't know?
Likely it could be the Badger Care estate. Not sure, but that would be most likely.
Okay. All right, we'll put that one in. And do we know if there's an HMO? Yes, no, or unsure?
Unsure.
Okay. All right, so we're going to go to next. And now we're going to talk specifically about the services that you might be looking for. So are you looking for screening or evaluation services?
Evaluation.
Okay. And do we know what kind of evaluation services? Would this be like a comprehensive mental health, autism screening, developmental screening, or not sure?
Developmental screening.
Okay. And are we looking for treatment services at this point? Yes or no?
Depends on the screening. So maybe.
Okay, let's put yes, just so we see what comes up.
Yep.
And so I'm thinking if we haven't done an assessment, we don't know a diagnosis yet. Would that be a correct?
Being it's a combination of a make-believe and a real, I can't, you're scrolling way too fast. I cannot.
There we go. Sorry.
Let's go. Let's see. Can you scroll up? Oh, wait, down. Sorry, you're already at the top. Okay. Let's go down. What's that one with the eating or but? Nope, not that one. There are only 4. Keep going down. React, no. Schizophrenia, no. Sensory processing.
Okay. All right, and the next question is, sorry, I'm doing the scroll thing that gives everyone a headache. All right, does the child have a significant disability, emotional, physical, or mental that requires a high level of care at home? So regular help with things like bathing, feeding, or toileting?
Yes.
Okay. And just a quick note here that if you weren't sure what that exactly meant, you could click here to learn more about that. Or if you get to the point you're like, I don't know how to answer any of this, you can just click with the specialist.
Sure.
And then the next thing is, are you looking for support services like occupational therapy, speech therapy, support groups? Yes? Okay. All right. And what might you be looking for?
Possibly occupational therapy, physical therapy, speech therapy.
Okay. All right. So that's the end of the screening. So we're going to go ahead and submit that. And then here is the customized guide for that child based on those responses. So we have the whole system here. If you wanted to jump to any of these, you could just go ahead and click here to any of these. So there we're going to go back to medical care, but let me just scroll up to the top so we can see the whole thing.
While you're scrolling, I have a question.
Yeah, sure.
I saw you clicking on 2 options that's available as well. So you can do multiple You can pick multiple things.
You can do multiple things. It gets to be pretty long. So we kind of say, just pick one, you know, the top priority. If you have, you know, if someone is going through and they have lots of needs, 9 times out of 10, they're just going to call us anyway. So,
all right.
Yeah.
The only reason why I'm really asking that is because the insurance question, are you able to push 2 options as well?
For insurance, yes, you're able to.
Okay, perfect.
Yeah.
Thank you.
Yep.
So I haven't figured out where to take my kid yet. When do I learn that?
All right, so let's take a look. So just a note, you can reset. A lot of people might have 2 children they want to take this for, so you can do 1 for each child. You can download as a PDF. You can also save by pressing this button here. And here's the other prompt. If you need help, just talk to someone. So this is insurance. And again, this is going to be customized based on how you respond to the insurance question. So, all right, this child already has health insurance, so that's great. So what we want them to do if they want to contact member services, there's the Eau Claire County. Oh, it was Polk County though. I wonder if it's...
That child packed their bag the other day and moved down to Eau Claire. They're living in a tent. No, okay, that was a joke.
Oh.
See a 4-year-old walking from Polk County to Eau Claire?
All right, so let me look and see why that did Eau Claire. And maybe it's that the 2 counties are combined for their consortium. Could be. Well, we can take a look at that.
Maybe, because I'm out in the middle of nowhere in Polk County.
Mm-hmm. So we say when you reach member services, you can ask to find out what HMO the child is in, ask what mental health services are covered on the plan, and then find out a list of mental health providers that are in that network. And what we find is a lot of people don't quite understand, what does that mean in network, or what does it mean, what's a deductible, what's an HMO. So what we can do is, if we have someone in that situation, you can click here for insurance terms. It should open in a new window. And then it has a list of all of the terms, what all of this good stuff is. So can take a look at that, but popping back here, the next thing is medical care. So we talk about the importance of a primary care provider, the steps to take, again, connect with a specialist. When you make an appointment to talk to your child's primary care provider, there's another article on talking points. I won't click into all of these, but if you want to, mess around and take a look at all of them, feel free. And then we get into mental health treatment and other therapies. So we have a section on the screening, evaluation, or assessment, since we selected that one, and the steps for that. So we're going to ask the primary care provider for the referral or recommendation. We have a section on developmental screening because we selected that. So what does that actually mean? We have our info sheet. Then we have our treatment services. We selected that as well, so we can find out the different types of services. Again, we want to go to insurance first on their behavioral health phone line. And then we can do our list of treatment services. So this is going to take us into a new page to the directory. And the reason why it's not listed within the document itself, if there's only one option, it's going to be in the document. If there's multiple, it's going to show up in this list so that you can see the full range. A lot of these, if they're statewide, the statewide ones are going to show up. You can see the full list here. It's all statewide here.
So I want to ask a question on this, kid. Back to the insurance. So as it turns out, Badger Care, or whatever the Wisconsin is, wasn't going to cover some of the scopes this 4-year-old needed. If a person is stuck in that route and they have determined that, would contacting this website maybe help? What are my other options? Badger Care is denying this. What do I do?
Yeah, I think for any situations where it's getting kind of that nuanced, or it's, not getting things paid for that maybe should be, or any complications with coverage or denials, you're best off just either contacting member services or contacting a Well Badger specialist. This website is not going to get into those level of details. So it's going to give more of like the full picture, and then any kind of troubleshooting would be with a one-on-one specialist. But yeah, that's a good question, because that's the kind of stuff that, that comes up quite often.
And it did actually come up, and that was actually real, but it turns out my insurance through my job would cover it because the care was in Minnesota.
Yeah.
And then Wisconsin picked up their part because the primary insurance had covered it.
Yeah, yeah. And actually you bring up a good point too, for any of the municipalities or those that live kind of on the border who potentially might get care in Minnesota, Iowa, Illinois. This only has Wisconsin. So that's important to note. We had a real big debate about whether or not we should include some of the border agencies as well. So that is a note that for those, you know, if you're promoting
look
this,
at Polk County, I live about a mile as a bird flies from Minnesota.
Yeah, yeah. So that's another one where like just contact a specialist in that situation. All right. So I know I'm kind of running out of time a little bit here, so I'll kind of fly through the rest of these. We got through our other therapy services. We're going to get into the county and tribal administered services. Again, you can click, you know, some of these links to learn more about what they are. Again, because there's only one option, it's going to show up here for CLTS. And any wraparound services. For school, we have quite a bit of info sheets for school, and that was something, you know, at first we only had one info sheet, and I think we ended up with 4 for school-centered services. So we have talking points, terminology. We have our Child Find program, services for enrolled students since the child is 4 that kind of fall into both. Just again, some steps to talk to the school age student service coordinator there. We keep this in even though the child is only 4. We do keep that in to talk about transition planning and then other agencies that might be available to help. And then we have family support and wellness. We don't get too specific here because that would make this probably 20 pages long. So we just say there's a lot of great agencies. If you have a really specific need, contact a Well Badger specialist. And same for basic needs and financial help, that they should just contact us. And then we have our crisis support information here as well, and should have the local ones pop up here, Northwest crisis line. And then that is pretty much it. So again, you can download, you can print, and have that as a resource, hopefully to get some next steps going and to connect with services as well. So, all right, I'm going to stop sharing that. Does anyone have a question before I wrap up?
I see Kimberly asked in the chat, do school districts know about Well Badger?
Yeah, they do. Actually, pre-pandemic, we had planned to do a lot of promotion with guidance counselors and others, school-based staff, and then that didn't happen. So hopefully, as things start to get to some semblance of normalcy, we can pick that back up. And Miranda, I know that is on her list to do outreach to schools as well. So.
One other question, what about pediatricians? Has this gone out to pediatricians in a organized fashion or any?
Yeah, a few like Children's of Wisconsin has that in their guide. I don't remember the exact name of it. It's like a guide for children with special healthcare needs and some others, but there hasn't been a huge coordinated statewide effort at this point anyway, but we're pretty quick post launch here, just a couple of weeks. So Miranda's taking notes.
Okay, and is this in a screen reader thing, website capability, like somebody can speech to text or text to speak?
Not quite yet. We're working on, because we have a lot of images. So what we need to do, kind of next step, is Spanish, and then step after that is we're going to have you know, everything in text so that it can be, all the images can be read as well. Yeah.
Perfect. Thank you.
Yeah, absolutely. All right. So moving on from the demo, I just wanted to wrap up with just a couple of items. We would love to stay in connection with all of you. If you work at an agency that provides direct services and you're not yet in the directory, we would welcome you to do that. This URL here is a great way to kind of a one-stop shop for all of that. If you're working with a client and patient, or you yourself want to contact us, you can do that here. We have tons of print material. We have tons of digital content, you know, so if you have a newsletter or social media, we have a bunch of pre-written items and images that you can just grab. Our listserv is a way to connect with us. We send those quarterly updates. And if your social media, your agency's social media, you can find us there as well. We push out a lot of content that way and like to lift up our partner sites so we can, if you have any great work that you're doing, definitely let us know so we can share that with our community as well. So that is all I have. If you have questions, my email is there. I'm sure Miranda would be happy to chat with you as well. And yeah, I will stop there and see if there's any other questions.
And so this is Karen, and I just want the whole team to know. I know, Chrissy, you have something you have to move on to at 3 o'clock, but we have 15 minutes left, or about 12 minutes left in this point of our agenda. So really do ask questions. And I have one. How can our group help get the word out? What can we do? Because the resource looks amazing, right? I think we all agree on that. How can we help?
Yeah, I think just pushing it out to those that you work with. Again, if you have a newsletter, social media, anything like that, you can grab any of that pre-written content or images and share it that way. And I would say if you know, if you are a direct service provider, you work with those that are, and you know that families are struggling, you can encourage them to use it or connect with Well Badger. We would welcome that.
Chrissy, this is Andrea. I'm curious what kind of response you've had so far. Like, how many folks are you finding are using the Well Badger Wizard in these last few weeks?
Yeah, so we've had a pretty strong response. What I don't know is if it's people just testing it out.
That's a good point.
So I think we're kind of waiting to see, what is kind of the long haul on this. We had a lot of traffic in these last 2 weeks. So yeah, we will let you know how this goes on in the long run. I'm going to pull up the chat because I think there was a little bit on there as well. Health check other services. Yeah, we do have that information actually as an info sheet. So if someone were to type that in just generally into the directory, they would get info on that.
Okay, so another question. Since we went from county run CLTS waiver wait list to now a state run wait list, are you guys giving updates on that?
Yeah, I think that our directory is either undergoing those edits or the edits have already been made. So with the directory, we will do, oops, I almost knocked over my whole computer. We'll do an annual verification every single year. But if there's a big change like this, like a centralized intake process, that's something that we can just update, in real time. And if an individual site, if they had a change, they can just go on their listing and there's a suggest and edit. They can just type in what they want to change and it'll take us a couple of days to update it. We also do have a special field as well. So for any COVID related updates, and we can use that for anything. So, a lot of places went from in-person to just telehealth. So we were able to reflect those changes as well, just kind of like a temporary change. So.
You talked about support groups. I saw that as one of your little click on things. Is that just support groups for individuals, or is that around medical needs? Is it about, family? Is it about, just moms? What is your, by, diagnosis? How is it?
Yep, so they fall into 2 buckets in the structure of the directory. So we have one for pregnancy and postpartum, and then we have another one just for child health. So within that bucket, it can include anything. It can be health diagnoses specific, it can be location specific. So it's really up to the agency that's hosting or running those support groups to give the details for all of that. We try to keep it pretty open in terms of what's in each listing so that it makes sense to the user on the user end. So if you want to try the drill down option, just go to children, youth with special healthcare needs, go to support groups, and you can see what we all have listed. That's one of those where we would love to build up any of these resources. I guess that's another takeaway, that if you notice like, oh, this one is not listed, or you see a listing and you think, that doesn't seem accurate, or it doesn't have enough information, just do a suggest and edit and update it for us, or let us know that it needs to be updated, and we have our resource management team takes care of all of those edits. So please help us make this as robust as possible and as accurate as possible as well.
Chrissy, I'm asking one more question, Karen. This is Andrea. Again, I'm curious how you see the interplay with other resource navigation resources and websites. Like, how do you see Well Badger and the new Wizard tool connecting and interfacing with other websites and programs and services that are trying to help families kind of get to the same end?
Yeah, exactly. So we have, I mean, throughout, if you click on any of the info sheets, or some of them actually appear within the wizard, we try to do as much, click into the next one as possible and try to really curate it. If you're looking for this specific thing and we know this resource exists, we want to get people there, right? We don't want to duplicate, anything. We're just trying to get people going to the right location. So yeah, that's another one where if there's an agency that provides direct services and they're not yet in the directory, we would love to get them in so we can make those connections happen.
Okay, great. Well, I'm going to stop recording.